Welcome to today's webinar presented by Supercoder.com. Supercoder.com is an online coding solution offering Part A and B coding reference tools, resources, and not more than 30 specialty coding and compliance newsletters from the Coding Institute in one site. I hope you enjoy this short session.
About mixing and matching these various kinds of E&M visits. So you got to be very careful. We'll talk more about that in much more detail. The next slide is clearly one of my favorites about how confusing it is from a coding perspective. I use this a lot in my major national seminars where I put this slide up in front of doctors and surgeons and other providers and certainly coders and everybody to just kind of humble us by going, it's like this is the OMG, no wonder we don't get paid very well, and no wonder we have trouble, and no wonder we don't know who to contact and how to work through stuff. So it's kind of a fun slide. The next several slides have a bunch of resources on it, so I'm leaving all that to you. Remember your state Medicaid program, wherever you are in the country or wherever. State Medicaid programs are technically federal programs, but they are administered and fiscally managed by that local state. So if you have a question that is not technically Medicare related and it's specific to your state Medicaid program, make sure you are interacting with the state Medicaid representative for your area, because they don't necessarily have to follow any of the Medicare guidelines, and we all know that most state Medicaid programs do not pay for preventative services. Now, if you're in a state that says, oh yeah, we do, and we do this, and we do that, then there's your answer. It's not up for discussion at that moment. That's exactly what it is, that your carrier is telling you that there's their answer. Remember, the private carriers have different answers for whether they recognize any of the so-called Medicare codes, like the so-called G codes. Do they only use the CPT designated codes like the 99386, 99397, blah, blah, blah? Blue Cross Blue Shield is notorious for making up their own S, like SAM codes, and then they assign their numbers to it. Well, if your state Blue Cross Blue Shield carrier recognizes those S codes and prefer you to bill with those S codes, then there's your answer. If they're the one paying the bill, that's kind of how the answer flies. When you look at slide, I believe it's number 8, medical necessity. Remember, medical necessity for these well people examinations, or welcome to Medicare, or whatever we are going to talk about in the next 55 minutes, is always subject to, is this visit medically necessary, and if so, why? And the why is what you are looking for when you are coding and billing these for your providers, to make sure that in your own head you are convinced that there's medical necessity. A quick little example would be a patient who is 50 years of age. She comes in for a well woman exam. Well, we all know, or we should know on this call at least, that a well woman exam falls into a criteria of whatever the age is appropriate and whether she's a new patient or an established patient. And then it breaks out into very specific guidelines per that age population or that age spread of population. And in it requires specific type of documentation regarding history information, examination information, counseling, anticipatory guidance, risk factor reduction interventions, ordering of any labs, diagnostic procedures, and again, it's related to that specific group. What is important for and what is required in one group may not be important, nor may it not be required for the next group. Okay, so look at the slide after the next picture, and that is, following preventative services are now covered by Medicare. This was released as of, I believe it was February of this year, of 2012. So when you look at that list,
SuperCoder is the fastest growing online reference tool with more than 25,000 subscribers. Call 866-228-9252 to get a free product demo or sign up at supercoder.com for a 7-day free trial.